After we were talking last time about blood clotting, and we know the phases of blood clotting as we discussed before, that we have hemostasis started by vascular spasms, and we have platelet reactions, and we talking about the coagulation, and the blood coagulation like intrinsic pathway, extrinsic pathway, common pathway, and we understand that we ended the blood clotting mechanism or blood coagulation by that the fibrinogen is converted to loose fibrin, which is insoluble. This one was soluble, then I make it like insoluble by thrombin. So thrombin come here to make fibrinogen to fibrin. And after we have this loose fibrin, we need to make it tight fibrin to be strong enough to make a stabilization. This stabilization, I need calcium and I need factor number 13. Till here is okay, but till here we finish the clotting. What does mean? But what happened exactly? After the clotting, you should start to make a tissue repair. And to make a tissue repair, you need that the platelets, actin and the myosin of the platelets should be contract. Of course, they have calcium as well. So actin and the myosin, by helping of the calcium in the platelets, will make them to contract. That contract of the platelets result in something very important expression called the clot retraction. Clot retraction to make the edges of the wound come together. So I make pulling the edges of the vessels. This results in decreasing the size of injured vessel. So the size of the wound will be decreased. I bring the edges together. This will make easy to complete repair. Now we finish the clotting. Now we know what happened at the wound side by clotting retraction. It's not logic after the tissue repair you keep the clotting. You should remove the clotting. Now tissue is repaired, there is no bleeding, skin are wounded together, so you need to remove the clotting by a process called the fibrinolysis. So here I do what? I do clot is dissolved by plasmin. So we have a specific protein called the plasmin. That plasmin will convert the tight fibrin in the fibrin degradation. So I break down the clotting. But that plasmin, it is the active form of a specific protein called the plasminogen. So after we finish the clot retraction, after the wound is healed, fibrinolysis happen by activation plasminogen by a specific protein called the tissue plasminogen activation. Tissue plasminogen activation is coming from the wound tissues. So where is the tissues are wounded, it releases a specific protein. That specific protein result in convert plasminogen to plasmin. The point that plasmin will go to convert the tight fibrin into degradation fibrin. I say for you here one of the most important, if you need to get like very close understanding, our body should be able to balance between the clotting and the anti-clotting mechanism. In our body, one of the most important decisions in our body is that we should decide where and when the blood clotting should be. Because blood clotting in wrong time or wrong place can result in death. So don't think that we should be able to make a blood clotting, but at the same time, coupled to it, we should be able to remove that clotting after we finish, and we should be able, or we should be able to say we don't need clotting now. So the anti-clotting mechanism, we have a general mechanism for anti-clotting, like by liver by removal or inactivation of activated factor, by endothelium cell and rapid blood flow. This will prevent the excitation of the factor number 12 or the platelet. So don't forget that the endothelial cell of our blood vessel should be able to release a specific material. That is specific material called NO, thrombomodulin, thrombin. That specific one can produce a specific protein called activate protein C. That activate protein C will be able to inhibit or inactive many clotting factor. Able to inactivate many clotting factor. So if you need to understand this result, I could say for you guys that we have smooth vascular endothelium cell. We have smooth vascular endothelial cells. This endothelial cell able to release specific molecules called NO, nitric oxide, like adenosine, like thrombomodulin. And these factors are able to make activation for protein called protein C. That protein C, guys, it's able to inactive many of the blood clotting coagulation factor. So, for example, inactive factor number 5, inactive factor number 8. Am I clear, guys? This able also to inactivate an inhibitor. يعني this able to inactivate of inhibitor of tissue plasminogen activator. يعني I keep the tissue plasminogen activator is active. You can imagine now, if this one is active, then I able to make this fibrinolysis. Here is the what I mean by endothelial cell. And we have heparin. Heparin is like natural anticoagulant, and this is found in the blood in minute amount. Okay, or we have a specific mechanism by interaction between thromboxane and prostacyclin, and this will result in clot formation at the site of injury only. Where is the wound, I should make a clotting. So, and keep the rest of vessel lumen free of clot. This interaction between, because thromboxane E2 is responsible to make platelet aggregation and activation. Prostacyclin is doing the opposite. So the balance between two result in the wound place thromboxane E2 will make a clotting, and in the other area of the blood vessels there is no blood clotting needed. We have something called antithrombin 3. Antithrombin 3, remember, I call it is wrong name, because you will think antithrombin 3 is the one which inhibits thrombin. Is wrong. Antithrombin 3 is the one which will inhibit the production of many blood coagulating factor like number 9, number 10, 11, 12. And the third mechanism of a specific anti-clotting mechanism is fibrinolysis system, what we explained here about plasminogen and plasmin. So anticoagulant, generally, substances used to prevent blood clotting. We have in vitro and in vivo. In vitro, what we do in the blood banks, what we do in the blood bags, for example. We add citrate. This citrate, EDTA, would make chelate of the calcium, catch the calcium. And we need the calcium for all the blood clotting reaction except the first reaction of intrinsic pathway. So, means chelate calcium. Oxalate will make precipitation of the calcium, so the calcium not be used. Or we have in vivo by injection, for example, heparin, intravenous or intramuscular, for example, but the heparin itself facilitates the function of antithrombin 3. Heparin facilitates the function of antithrombin 3. And we have one called dicumarol. Dicumarol is kind of oral by mouth, you get it, and it is looking like vitamin K, so it's working as a competitive inhibitor for vitamin K. What relation of vitamin K and the blood coagulation? Vitamin K is needed by the heart to producing most of the blood clotting factor. So our heart without vitamin K not be able to make production for blood coagulating factor. This is very important. So this dicumarol is kind of oral tablet which make a competitive inhibitor for vitamin K in the liver, which inhibits synthesis of the factor, like factor number 2, factor number 7, factor number 9, number 10. you don't remember, يعني you don't need to go for the details here, but just to understand. So most of the abnormalities of homeostasis is because of vitamin K deficiency. Most of the abnormalities, vitamin K deficiency. You should know what is vitamin K. Is lipid soluble vitamin, and it is coming by the bacterial floral in our digestive system. So it is fat soluble vitamin and is synthesized by the bacterial flora of the intestine. Its importance to make the production of factor number 2, factor number 7, factor number 9, factor number 10 in the liver. So the deficiency of vitamin K will decrease the formation of that factor and prolong clotting time. So most of the causes for deficiency of vitamin K because of less bacterial flora, as a newborn infants, for example, or you make prolonged treatment with antibiotics, or decreasing of absorption, especially in the cases of fat male absorption. Fat male absorption, like what, guys? We studied this in the jaundice. Bile duct obstruction, and maybe use of anticoagulant for long time, like dicumarol. Here is what we should know. I just need to add something here for you. Under the abnormalities of hemostasis, maybe you remember something called hemophilia. We have one disease called the hemophilia. And this hemophilia is kind of X-linked recessive disease. X-linked recessive. So it is famous in males and female. And it is by severe prolonged bleeding in very mild trauma or prolonged clotting time. I say again, hemophilia means severe prolonged bleeding in mild trauma or prolonged clotting time. We have many types, for example. We have hemophilia A, and we have hemophilia B, and we have hemophilia C. Hemophilia A because deficiency in the factor number 8. Hemophilia B because deficiency in the factor number 9. Hemophilia C is the deficiency in the factor number 11. But here is the most cases, hemophilia E. I hope it's okay, guys.